Hi friends, welcome to classes by Lab Doctor. In today's class, let us discuss about the symptoms of anemia. So you all know that anemia is a very common clinical condition that we see in day-to-day practice. Okay, and anemia by itself is not a disease, it's a manifestation of some disease. So it becomes very important to find out what is that disease causing this anemia or this decreased oxygen carrying capacity of the blood. Because there are less RBCs, the hemoglobin is less, the oxygen carrying capacity of the blood is reduced, and patients presents with so many varied symptoms. Remember, all these symptoms can be seen in various other diseases also, but you should also rule out anemia when you see a patient presenting with these symptoms. So एनीमिया बहुत ही कॉमन एक कंडीशन है जहाँ पे आपको बहुत सारे सिम्टम्स पेशेंट्स के दिखेंगे. ये सिम्टम्स काफ़ी अदर डिसीजेस में भी आपको मिलेंगे, बट आपको याद रखना है कि अनीमिया भी ऐसे सिम्टम्स से प्रेजेंट कर सकते हैं. अगर कोई पेशेंट ऐसे सिम्टम्स से आते हैं तो यू शुड always keep anemia as one of the differential diagnosis. So there are few common symptoms, few uncommon symptoms of anemia. So the some common symptoms would be tiredness, lack of energy, fatigue, weakness. Sometimes the skin will have yellowish tinge, usually it is pale. Patient might find shortness of breath, especially when he does some kind of an activity. There might be headache, there might be dizziness, lightheadedness, cold hands and feet. So tiredness and fatigue. बहुत ही टायर्ड हो जाता है पेशेंट, नो मैटर वो कितना रेस्ट लेता है, नो मैटर हाउ वेल ही ईट्स और हाउ मच ही रेस्ट, he will always be tired, because the oxygen carrying capacity of the blood is reduced. All the tissues, the organs are not perfused with enough of oxygen, so the body is not well oxygenated, and hence the tiredness, hence the lethargy, hence the weakness, hence the fatigue. Okay, so because of all these things the patient always complains of fatigue. He for even with small activity he is tired always, he's weak, he's lethargic, he feels dizzy sometimes, lightheaded sometimes, all because of this anemia. Patient, if you look at them, they are like pale, parched, that is the tone of the skin color. So sometimes in hemolytic anemia and all, if there is increased bilirubin, patient can also have a yellowish tinge to the skin. So especially your B12 deficiency anemia, etc., hemolytic anemia, wherein the bilirubin can go up and patient can have an yellowish tinge. Shortness of the breath. See here again the oxygen supply to the tissues is not maintained. Hence when the patient does some activity, he just runs or takes a stairs, the demand is more. The supply is not met with this less oxygen. Hence the patient complains of shortness of breath. But that too for a very some small activities also patient might find it difficult to do such mundane activities also. So patient will have shortness of breath, he might have increased heartbeat, etc. Patient might start sweating. All these symptoms can come when the patient is anemic. So headache. In patients who are anemic, what happens? Because of the lack of this oxygen supply, the brain also receives less oxygen. So this can trigger this dull, persistent headache in such people. If you already have a migraine, etc., that might worsen. Sometimes what happens now, the blood vessels, they are widening. To compensate this less oxygen, patient might complain of headache. So patient can have headache due to various reasons, because of his vision, because of stress, because of anxiety, migraine, etc. But repeatedly patient is having such headaches. Anemia can also be one of the reason for your headache. Cold hand and feet. See patient, if you touch their hand, if you touch their feet, it is very cold because there is the circulation itself is not happening properly, okay, because there is less of healthy RBCs, there is less of oxygen transport which is being done to these peripheral tissues, and hence there is this coldness in the hands and in the feet, especially during with your iron deficiency, vitamin B12 deficiency anemia. We can see this more commonly. Yes, so this coldness of your hand and feet can happen in various other conditions also, including your peripheral vascular diseases, etc. But anemia can also be one of the cause for this cold hand and feet. Okay, so coldness of the hand and feet. Brittle nails. See, for your nails to grow well, your hair to grow well, you require proper nutrition, you require oxygen supply, etc. But here in anemia, when the oxygen supply itself is hampered, the hair follicle or your nail, the growth, etc., will be impaired. Hence, this leads to this brittle or easily breakable nails or easily breakable hair, leading to hair loss, increased shedding of the hair, etc. So your brittle nails, your lusterless skin, or your increased hair fall can all happen because of anemia. So now hair fall can happen because of so many reasons, your thyroid, your deficiencies, or your scalp issues, etc. But as a simple condition as an anemia can also trigger this hair loss or your brittle nails, etc. So anemia can also be one of the causes for this brittle nails. There are lot many mouth changes, tongue changes which happen in anemia. Okay, so it can cause glossitis, the tongue might be inflamed, there can be geographic tongue, there can be soreness, there can be difficulty in swallowing. See, patient who is already anemic, he has so many nutritional deficiencies, and on top of this, if he develops something like this, his nutrition again will be compromised and he will have a severe anemia. Okay, so all this iron deficiency, B12 deficiency, folate deficiency can lead to such changes in the tongue. And sometimes patient develop what is called as pica. You know, they have this craving and persistent craving for non-nutritional food like your chalk, your clay, your ice, your paper. They feel like eating such substances, your raw rice. This is called as pica. Especially we see this with iron deficiency anemia. So they want to eat such non-nutritive substances. Okay, and this is called as pica, and this improves when we treat the patient with iron supplements, etc. Okay, so pica is also one of the symptom of anemia. I have told you mouth changes. Patient can have dry mouth. Patient can have mouth ulcers, sores. There can be burning sensation in the mouth. There can be redness of the mouth. There can be glossitis. There can be inflammation and cracking at the corners of the mouth called as angular cheilitis. Okay, so all this can happen in anemia. Okay, and once we supplement the patient with adequate iron or B12 or folic acid, these symptoms improve drastically. Eye changes. So usually if you see normal conjunctiva, it is pink, but patients who are anemic, they have a very pale conjunctiva. Sometimes if you see the sclera of these patients, we can see usually this in children who are having severe iron deficiency, there is thinning of the sclera, and the collagen what is present here will allow the blue color of the underlying uvea to show through, and hence you get this bluish tinge. Okay, so such eye changes can also be seen in cases of anemia, especially severe anemia. You see this bluish tinge of the eye. Sometimes patient complains of restless leg syndrome. You might be seeing some patients who constantly keep moving their leg. They are very restless. You know, this happens in various other conditions, including your anxiety, stress. But anemia can also be one of the reasons for your restless leg syndrome. Here they have an urge to, continuously keep moving their legs, and they have tingling sensation, burning sensation, pain in their legs. So this is called as restless leg syndrome. Especially when you have low iron levels in the brain, this will affect your dopamine production. That is the neurotransmitter which is involved in your restless leg syndrome. So if you treat this anemia, if you supplement them with adequate iron, B12, etc., the whatever symptom of this restless leg syndrome disappears. So restless leg syndrome, moving, irresistible urge to move the legs, continuously keep moving their legs, etc., can also be a symptom of anemia. Ear changes. What happens is sometimes patient hear this ringing sound, or sometimes patient can hear their own heartbeat, that pounding or whooshing sound in the ears because of this anemia. Anemia, the heart is under stress. It has to pump more adequately to supply enough of blood so that adequate amount of oxygen is received to the tissues. And because of these, ears also become they can hear this ringing sound, or they can hear this whooshing sound, and patient can complain of tinnitus. Now tinnitus can happen because of various reasons, including your ear issues, etc., but anemia also can be one of the reason for this tinnitus. Spoon-shaped nails. So you will see that in iron deficiency anemia, the nails become spoon-shaped. So that is called as koilonychia. Okay. So this is also very, very common with iron deficiency. And when we supplement this patient with iron, these changes will be reversed. So koilonychia or spoon-shaped nails. In anemia, patient can have memory problems. Memory problems like they might have trouble remembering things, or they might have trouble concentrating, focusing. There might be a brain fog. All these can signal that the patient might be having anemia. Okay. Some researchers have even suggested that severe anemia is linked with higher risk of mild cognitive impairment, which can be a precursor to your Alzheimer's and other type of dementia. Okay, mainly all these things are happening because there is decreased oxygen supply to the brain, and there are subtle changes which are happening in the brain which are leading to all these symptoms like brain fogging, memory issue, focusing issue, concentration issues, etc. I have told you that these are few of the symptoms which are related to anemia. It could be tiredness, it could be lack of energy, it could be severe weakness, fatigue, skin becomes pale, conjunctiva is pale, or skin can have an yellowish tinge. There can be shortness of breath, especially when you are doing an activity. Headaches can be there, or headaches can worsen. There can be dizziness, there can be lightheadedness. Hands and feet can be cold. They can have a rapid heartbeat, palpitation, because heart is under stress now. The nails can be very much brittle. There can be hair loss, tongue changes, mouth ulcers, dry mouth, angular cheilitis, geographic tongue. All this can happen in anemia. They can develop a craving for non-nutritive food like clay or chalk or mud, etc., called as pica. There can be bluish tinge in the white of the eye in severe iron deficiency anemia. Patient can complain of restless leg syndrome. There can be tinnitus. So all these symptoms can come in anemia. As I have told you, remember all these symptoms can come in various other diseases. So whenever you see such symptoms, you should always try and find out what is the cause for such a symptom. Why the patient is tired, why the patient is having headache, why the patient is complaining about cold feet, etc. And one of the differential diagnosis will be your anemia, because anemia is a condition where the oxygen supply itself is hampered, is compromised, and hence patient can have various symptoms from head to toe, and that can be confused with some other diseases also. But yes, anemia can produce all these symptoms. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.